Welcome to my channel. Today we are doing Domain 4 Psychotherapy. If you are preparing for your PMHNP ANCC exam, this is a place to be. Remember to subscribe to my channel, on your notification button so that you will know when I drop my videos. You can check on my channel. We have Domain 1 question, we have Domain 2 questions, we have Domain 3, and today we are doing Domain 4. There are other courses, other things that we have done, other videos that we also did on different high yield exam questions that will help you as you are preparing for your exam. Your success is our priority. We are here to help you to study with grace and pass with confidence. So in this section, we are covering psychotherapy domain 4 questions. We have questions that follow ANCC style case based format. We have the answers, we have rationales that will help you to understand the content, and also we have exam tips that will help you to remember this content during your exam. So we are loaded. Like I said, your success is our priority. Do well to subscribe. Remember to follow, comment, share, and if there is any topic or anything that you want me to cover, please do well and put it in the comment section, and I will try as much as I can to bring that to you because I want you to succeed, and we are going to be doing this together. So let's look at these questions. We have our question 1 here that says, a 24-year-old woman presents with a long history of unstable relationships, intense fear of abandonment, chronic feelings of emptiness, and recurring self-injurious behavior during periods of emotional distress. She reports difficulty regulating her emotions and frequent impulsive decisions when overwhelmed. Which psychotherapy is most appropriate for this kind of situation? Look at the options that we have here. We have cognitive behavior therapy, dialectical behavior therapy, psychoanalytic therapy, and supportive therapy. Before I review the correct answer, what do you think? Can you put your answers in the comment section, please? And we have the correct answer as B, dialectical behavior therapy. Why is dialectical behavior therapy the best therapy for this kind of presentation? The patient's core problem is emotional dysregulation with impulsivity and self-harm. This is characteristics of borderline personality disorder. In your exam, whenever you see borderline personality disorder, think about DBT. Dialectical behavior therapy specifically targets the stress tolerance, emotional regulation, interpersonal effectiveness, and reduction of self-injurious behavior. When you talk about cognitive behavioral therapy, that one focuses on cognitive distortions, but does not adequately address any chronic self-harm. Psychoanalytic, on the other hand, and supportive therapies are not first-line treatment for this kind of presentation. So on your ANCC exam, you must think borderline DBT. When you see emotional dysregulation plus impulsivity plus self-harm, think DBT. That is borderline there. Let's move to the next question. A 38-year-old veteran presents with recurrent nightmares, intrusive memories of combat, avoidance of reminders, and hypervigilance. He reports feeling emotionally detached and re-experiencing traumatic events during the day. Which psychotherapy best addresses his symptoms? First of all, think about the symptoms. What do you think that this man is going through? Then let's look at the options. We have supportive therapy. B says eye movement, desensitization and reprocessing. C, family therapy. D, psychoanalysis. Can you put your answer in the comment section, please? What do you think? Test your knowledge. The correct answer is eye movement, desensitization and reprocessing. Why is this the correct answer? This patient demonstrates classic post-traumatic stress disorder, particularly intrusive traumatic memories and re-experiencing. So EMDR is a trauma-focused therapy designed to process and integrate to traumatic memories. Supportive therapy alone does not directly address trauma processing, and psychoanalysis is not the first line for PTSD on the exam. So when you in your exam, when you see trauma and memories, think about PTSD, or when you see PTSD, think of and flashback, think about EMDR. That is the first line therapy for that kind of presentation or disorder. Next, a 30-year-old patient reports persistent intrusive thoughts about contamination and engages in repetitive hand washing rituals to reduce anxiety. He recognizes the behaviors are excessive but feels unable to stop. Which psychotherapy is most effective? Also look at the presentation. These presentations will also help you to identify, if you look at the presentation, if you're able to identify the presentations in different disorders, it will help you to identify the disorders also. And when you know the disorder, you will be able to remember the treatment or the kind of therapy that is associated with these disorders. So as you are reading the question, this is a learning process for you also. Think about the disorders. When you look at the symptoms, what kind of disorder have this kind of presentation? I want you to start thinking like that. So let's look at the options. Insight-oriented therapy, cognitive behavioral therapy without exposure, exposure and response prevention, supportive therapy. So let's look at the answer. If you know the answer, please put it in the comment section. The correct answer is exposure and response prevention. Why is this the correct answer? Obsessive compulsive disorder is driven by intrusive thoughts and compulsive behaviors. So exposure and response prevention directly targets compulsions by preventing ritual behaviors while allowing anxiety to decrease through habituation. So insight-oriented and supportive therapy do not interrupt compulsive cycles, and they are not effective when used alone. If you look at the exam tip, it says intrusive thoughts plus compulsion, think about the exposure and response prevention therapy. The next one says a 42-year-old patient with major depressive disorder reports persistent negative automatic thoughts, feelings of worthlessness and hopelessness. She prefers psychotherapy and wants a structured, goal-oriented approach. Which therapy is most appropriate? This patient have major depressive disorder. This patient is reporting persistent negative automatic thoughts, feelings of worthlessness and hopelessness. What kind of therapy do you think will be best for this kind of patient? A. Supportive therapy. B. Interpersonal therapy. C. Cognitive behavior therapy. And D. Psychoanalysis therapy. What do you think? Kindly put your answers in the comment section, please. The answer is cognitive behavior therapy. Why is this therapy the best therapy for this patient at this time? When you look at our rationale, it says that major depressive disorder is often associated with cognitive distortion and negative thought patterns. So CBT directly challenges maladaptive thinking and replaces it with healthier cognitive frameworks. Supportive therapy lacks structured cognitive restructuring, and psychoanalysis is not first line therapy for this kind of disorder. So CBT, remember that CBT usually deals with thoughts. When someone is has major depressive disorder, what is this patient thinking? When somebody is thinking I'm worthless, I don't amount for anything. When somebody is thinking everything is bad, the person is this is coming from the thought, and the best way to handle this is to challenge that thought and replace it with a positive one. So you have to target the thought, and CBT is the therapy that targets the thinking. So in the exam tips, when you see negative thinking pattern plus depression, think about CBT. And when you also remember that, how does CBT work? Because they will also want to know if you know the mode of operation of these therapies. Remember that CBT deals with the thought distortion. A 35-year-old patient presents with depressive symptoms following a recent divorce and difficulty adjusting to changes in social roles. He reports interpersonal conflict and feelings of isolation, but no history of chronic mood disorder. Which psychotherapy is most appropriate? A. Cognitive behavior therapy. B. Dialectical behavior therapy. C. Interpersonal therapy. And D. Exposure therapy. From what we have read, what do you think is the best answer for this? Interpersonal therapy. Why is it interpersonal therapy? Why is it not CBT? Let's look at the rationale. These patient symptoms are closely tied to relationship stressor and role transition. So interpersonal therapy focuses on improving communication, resolving interpersonal conflict, and adapting to role changes. CBT, like we said earlier, targets cognitive distortions rather than relationship patterns. And DBT is reserved for emotional dysregulation and self-harm. As you are reading this rationale, if you can make a note from these rationales, you should make a note, because these rationales will help you to understand the content. There are other things that you will learn as you are reading this cognition, this rationale. You are also understanding other parts of therapy. So if I were you, I would take my notes and make some notes, or you can always come back, always play this video over and over as many times as possible until you have understood this concept very well. Exam tips. Remember, when you see relationship conflict or role transitions, remember IBP. If you are watching this video and you have not subscribed to my channel, please do well subscribe to my channel. Put on your notification button. Remember that we have other domains like domain 1, domain 3, 2, domain 3 on the channel. There are other videos that we did on different topics, higher topics that will help you if you are preparing for your ANCC exam. If you are a nursing student, this is a place to be. Remember to subscribe. As you are watching this video, do well to like, comment, share this video, and invite others to subscribe. We are here to help make your study easy, and we want you to pass with grace. So let's continue. A 29-year-old woman presents with excessive worry occurring most days for over 6 months, difficulty controlling the worry, muscle tension, restlessness, and sleep disturbance. She prefers psychotherapy. Which psychotherapy is most appropriate? We have A, supportive therapy, B, cognitive behavioral therapy, C, psychoanalysis, and D, exposure therapy. What do you think is the correct answer? Put your answers in the comment section, please. This is cognitive behavior therapy. Why is it cognitive behavior therapy? Generalized anxiety disorder is characterized by excessive, uncontrollable worry and cognitive distortion. So cognitive behavior therapy directly targets maladaptive thought patterns and teaches coping skills to manage anxiety. Supportive therapy lacks structure, cognitive techniques. Psychoanalysis is not first line on the exam, and exposure therapy is more appropriate for phobias and PTSD. Exam tip: when you see excessive worry across domains, think about CBT, cognitive behavior therapy. A 40-year-old patient with post-traumatic stress disorder reports avoidance of trauma reminders, and persistent hyperarousal. He is willing to engage in therapy to reduce fear responses. Which psychotherapy is most appropriate? A, supportive therapy. B, eye movement desensitization and reprocessing. C, exposure therapy. D, interpersonal therapy. What do you think is the correct answer? Put your answers in the comment section, please. The correct answer is exposure therapy. Why is it exposure therapy this time? This patient demonstrates avoidance and conditioned fear response related to trauma. So exposure therapy reduces fear through gradual, repeated exposure to trauma-related stimuli. So EMDR focuses on trauma memory and processing, while supportive and interpersonal therapy do not directly reduce avoidance behavior. In your exam, if you see avoidance and fear response, think about exposure therapy. You see the reason why I say you should get your notes and write when you are reading this rationale. The rationale will expose you to the content and will help you to understand the content more. We have rich rationale here. And if you have not subscribed to my channel, please do well and subscribe. Remember to like, share, and comment on this. Next question. A 33-year-old patient presents with chronic emotional instability, intense emotional reactions, and interpersonal conflict, but denies current self-harm. Which psychotherapy is most appropriate? A. Cognitive behavior therapy. B. Dialectical behavior therapy. C. Interpersonal therapy. And D. Supportive therapy. What do you think is the correct answer? This is a 33-year-old person who presents with chronic emotional instability, intense emotional reactions, and interpersonal conflicts, but denies current self-harm. What do you think is the answer? Here is dialectical behavior therapy. Why is dialectical behavior therapy the answer? Even without active self-harm, emotional dysregulation and interpersonal instability suggest borderline personality traits. So dialectical behavior therapy targets emotion regulation, distress tolerance, and interpersonal effectiveness. CBT and supportive therapy do not adequately address chronic emotional instability. So when you see emotional instability and interpersonal chaos, just think about DBT. This is borderline personality disorder. Next. A 36-year-old patient with obsessive compulsive disorder recognizes his thoughts are irrational but continues repetitive checking behaviors to relieve anxiety. Which psychotherapy is most effective? This is OCD in action. So what do you think? We have supportive therapy, we have cognitive behavior therapy without exposure, we have exposure and response prevention, and we have insight-oriented therapy. Which therapy is the correct one? Please put it in the comment section. This is exposure and response prevention. Why? Obsessive compulsive disorder is maintained by compulsive behaviors that reduce anxiety. So exposure and response prevention interrupts the ritual cycle by preventing compulsions while allowing anxiety to diminish naturally. Other therapies do not disrupt compulsive behavior pattern. Remember that earlier I told you when you see OCD, think about the exposure and response prevention. Compulsion uses used to relieve anxiety. You think about the exposure and response prevention therapy. A 45-year-old patient reports distress related to ongoing marital conflict and communication difficulties without prominent cognitive distortion. Which psychotherapy is most appropriate? A. Cognitive behavior therapy. B. Dialectical behavior therapy. C. Interpersonal therapy. And D. Psychoanalysis therapy. What do you think is the answer? This is a relationship problem, ongoing marital conflict and communication difficulty. Put your answers in the comment section. Interpersonal therapy. The patient's symptoms are driven by relationship conflict and communication problems. Interpersonal therapy focuses on improving communication and resolving relationship disputes. So CBT targets cognitive distortion rather than interpersonal dynamics, and DBT is reserved for emotional dysregulation. So the appropriate therapy here is the interpersonal interpersonal therapy. So when you see relationship conflict and communication problem, think about interpersonal therapy. And this is the end of the first part of this. Remember to subscribe. Do not forget to subscribe, share, and comment. Invite others to join, and watch out for the main 4 part 2. Thank you.